So, good nursing care prevents the complications from bed rest. What is good nursing care? You might be saying. We're going to show you that in this chapter. We're going to give you the ideas. The care plan and your assignment sheet will also include the person's activity level and their needed exercises. So once you learn the exercises, like range of motion exercises, you can look at your care plans. You can look at your assignment sheets and get to know more about your person. Um, okay, let's move on to the next slide. Bed rest. Most nurses, and I'm sure your parents are the same way, really don't like bed rest. I always worry. I was taught that bed rest is not good. Um, it has so many complications, like I said, that we'll talk about, that as nurses, we really promote the person get up and get moving. However, there are certain things that doctors might say the person has to be on bed rest for. Um, if the doctor orders bed rest, these would be some of the reasons why. He wants to reduce the physical activity of the person, meaning the person needs to just chill. He might say, I want them on bed rest to reduce their pain. They're in too much pain when they're up and moving around. And when somebody's in pain, we know their blood pressure and their pulse can also be affected by that. So he might want them to rest for that reason. Doctor might order bed rest to encourage rest because the person is exhausted, or maybe they're pregnant and they need to be on bed rest to decrease the pressure on the baby, okay, to regain strength after surgery. Doctor might order bed rest, or after a stroke, he might say, we're going to have let the person have periods of bed rest and periods of rehab, okay, and to promote healing. Maybe they have something going on where they can't be up on their feet. Maybe they have a broken leg. Maybe they have a wound or a sore on the bottom of their foot. And if they're up moving around, it's just going to make things worse. Um, there are different types of bed rest. These are the ones that we're going to talk about. These are the most common types. One is called strict bed rest. Strict bed rest. Strict bed rest means exactly what it means, strict. Nothing can happen. That person cannot have anything for themselves. You have to do it all for them. You do everything. They're like the Queen of England. If they want their teeth brushed, you brush it. If they need to go to the bathroom, they get a bedpan. If they need to be turned, you turn them. If they need to eat, you feed them. So you're doing everything for them, all their activities of daily living. Okay. And then we have bed rest. Regular bed rest means the person can do some of their stuff for them. So if you set them up with a toothbrush and toothpaste, they should be able to brush their teeth, but they can't get out of bed. They have to do it at the bed, in the bed. Okay. Um, Maybe they want to eat, so you bring their tray in, you cut up their food, you set up the tray in front of them. As long as they can feed themselves, that's fine. But again, they have to stay in bed. Then we have bed rest with a commode privilege. Commodes are like little porta potties or potty chairs that we could sit at the bedside. The person can get out of that bed to use the commode, and then they have to get right back to the bed. Okay. Um, and with that, you want to make sure that the priority is getting your patient safely back to bed, and then you can empty out that commode and take care of the hygiene part of cleaning the room so there's no odors. Okay. But again, make sure you provide privacy if they're using a commode, and make sure safety is your number one concern, and then clean up afterwards. Then we have bed rest with bathroom privileges. Just like it sounds like, they are on bed rest, but they could be up to the bathroom to use the bathroom and then back to bed. Okay, not I'm going to go for a quick walk. It's in bed unless they need to use the bathroom. Then they can walk to the bathroom with your assist, most likely, use the bathroom, and then back to bed. So we call that BRP, bathroom privileges. B for bath, R for room, P for privileges. Okay, so those are your four types of bed rest. The doctor orders bed rest usually to treat a health problem. Something's going on, and that's why he's ordering bed rest. It might also be ordered by your nurse just because the person's blood pressure is elevated, like a condition change, so we got to order bed rest. No activities daily living are allowed when somebody's on strict bed rest. Make sure you remember that. Um, and I think we covered the other ones. Just make sure strict bed rest, you're doing it all. They're like the Queen of England. Okay, we're going to pause here.